Hi, everybody, and welcome to tonight's webinar. I'm excited to be talking about common questions that you all have and trying my best to answer them all for you. This is going to be a pretty casual webinar, and I am literally going to answer the questions that you all have submitted to our Facebook page or to your territory managers. So let's get stuck right into it. So the very first question that I got asked was, what was the most frequently used supplements for performance horses? Didn't necessarily specify discipline, but just performance horses in general, high-level performance horses. Well, for me, the DAC digestive feed additive is something that every horse every day should be fed. And the reason why I think it should be really important for performance horses is performance horses are typically going to be taken out of their natural environment. They're going to be probably fed more high grain-based concentrates. They're going to live more in stalls and eat more hay. They're going to be trailering. They're going to be going to shows, getting exposed to environments that are not recognizable to them, maybe new stalls with new smells and new stresses. And so the DAC digestive feed additive has ingredients in it that are, number one, going to keep the gut healthy. Stress, we know the first place that stress affects is the gut, upsets the gut bacteria. First thing you notice in your horse when he gets stressed is loose manure. That is an upset in that gut bacteria. So the DDA has ingredients like the live cell yeast and the biomass that are going to help to stabilize that hindgut bacteria, specifically when we stress them. So the DDA, a lot of these horses, we've seen graphs, and I'll show you again. 90% of our performance horses have gastric ulcers, and about 60% have hindgut ulcers, and about half the population have them in both regions of the stomach. So the cool gut, we know, is designed for foregut and hindgut health, to support that tissue, to buffer stomach acid and hindgut acidity, and just maintain good, healthy bacterial populations. We use that novel form of calcium to buffer the stomach acid, so it's really highly available calcium. We've also now got that Butapearl Z, which helps with the hindgut and hindgut tissue health. But we also have the pre-buff, and the pre-buff, you know that we've been kind of tweaking this since really late last year. And we have a formulation now that we're really satisfied with that has undergone rigorous testing through the University of Kentucky. And we know that it has all the ingredients that it needs and none that it doesn't. And it helps to dilute that acid or buffer that acid into a range that is normal for horses. And so the pre-buff, unlike the cool gut, where horses should be on that and should be adjusted to that, the pre-buff is something that you give immediately prior to any kind of stressful event, and it's going to immediately have results on that horse. It's not something that they have to be adjusted to. We have a lot of younger horses, younger performance horses that really can benefit from the LQHA plus. Anywhere from 2 years of age through usually about 10 to 15 before they develop full-blown osteoarthritis or arthritic conditions. Once they start to develop those arthritic conditions, we really want to switch them over to Optimum Flex Plus. But the LQHA Plus is the hyaluronic acid. The hyaluronic acid is a key component in synovial fluid, and synovial fluid is in the joint capsule. When we exercise young horses, and we're doing more and more futurity classes, we're exercising these young horses, and prior to that horse even getting to the futurity, there's months and months of work that goes into that horse prior to that. So these horses are doing a lot of work on these young underdeveloped bones, and it doesn't matter what discipline you're in, the futurity or young horse classes are more and more popular. And so when we exercise and put stress on these young animals, that stress thins out the synovial fluid in the joints. And that synovial fluid in the joints is made up of hyaluronic acid, and its role is to be the lubrication between bones and between those ends of those joints, so that we don't get rubbing and more inflammation. Well, when we exercise these horses and stress these horses, it just thins out that synovial fluid. So the LQHA plus helps to thicken the viscosity and keep that synovial fluid strong. So that's why I recommend it for younger horses that don't necessarily have active joint disease. But once we start to see arthritis or joint disease, and I can't really say that there's an age attached to that, it could be 10, it could be 15, it could be 20, then Optimum Flex is more ideal because it's got a more complete. It's got glucosamine, chondroitin, MSM, vitamin C, hyaluronic acid, because they all work at different parts of the joint. They work on cartilage production. They look at bone development. They look at that synovial fluid, whereas the LQHA plus is just looking at the viscosity and the synovial fluid. The Calm B, a lot of our performance horses are under stress and anxiety. And so the Calm B can be beneficial for performance horses. And there is nothing in the Calm B that will test in any discipline. It's magnesium and tryptophan. Both are essential nutrients in the equine diet. Now, a lot of our performance horses are getting a commercial concentrate that is fortified with vitamins and minerals. So that's why I have Total Performance closer to the bottom of this list. Because if you're feeding a commercial concentrate at the recommended amount, then most likely your horse is getting enough vitamins and minerals. But there are a lot of times where the feeding directions say we should feed 6 to 8 pounds, but maybe we feed 4 to 6 pounds. And so we're shortchanging that horse on the vitamins and minerals. So top dressing with Total Performance would be ideal. If we have a horse that struggles to maintain body weight or coat condition, then the oil is used a lot in performance horses. And the vitamin E, the E natural, because these performance horses, a lot of times we're struggling with top line and muscle development, and we're feeding protein supplements when we should be feeding natural vitamin E, because remember, we're taking these horses out of their natural environment. They're not eating fresh green grass, so we need to be supplementing the vitamin E that they're not getting from that pasture. So they're the supplements that are. These aren't the exclusive supplements that are fed to performance horses, but in my opinion, these are probably the most common supplements fed to performance horses. Now, there's been some question about the pre-buff when we first rolled it out, when we first launched it last year in October, November, there was magnesium in the product. But what we found in research that we've done since then was that combination of magnesium and calcium really formed a cement-like structure. And so we removed the magnesium, and that calcite, that honeycomb, really bioavailable calcium, is extremely effective, more effective than just plain calcium carbonate. And so we took the magnesium out, and we've got a much more fluid supplement that's easier to deliver to the horses. We also were able to decrease the serving size to 30 cc's for that adult horse and 20 cc's for the younger animals, because we did, as I mentioned, research at the University of Kentucky, where the ability to buffer occurred immediately in this formulation of the Prebuff, and it lasted for the duration of the trial, which was 2 hours. So it wasn't that it stopped buffering after 2 hours. That was just where we stopped the research. My extrapolation is that at least 4 to 5 hours we're going to see buffering with the pre-buff. Now, we'll see later on, there's a graph that I'll show you. When horses eat free choice access to hay, the acidity in their stomach sits between a 4 and a 7, and that's really the natural range of where the acidity in the stomach should sit. And so this formulation, this quantity of pre-buff, makes the pH of the stomach sits right there. For any of you dealers that are looking for the most recent marketing materials, I have posted all of these in the DAC dealer Facebook page. If you look through the posts and if you look in the files on the right hand side, there are flyers, there are advertisements. This page is available there, which is the updated catalog page. So all of the marketing materials that you should need are right there on the DAC Dealer Facebook page. This is the most accurate label. You can see we've got calcium and threonine, and first ingredient is water, second ingredient calcite, that really bioavailable calcium source. Next question that I got was what is the best for arthritic horses? Typically, I don't usually see a lot of horses that are 10 that have arthritis, but you never know. You know, we're doing a lot more futurities with these young horses, and so there's a lot more stress put on them as youngsters. So by 10, maybe we're putting enough pressure on some horses, or maybe it was a racehorse that you have given a second career or third career. So yeah, whilst it seems odd to have younger horses with these arthritic conditions, it's probably a question that I get more and more. But again, as I mentioned before, the horse that has been diagnosed with arthritis, 100% Optimum Flex Plus. The younger horse, where we're just looking for more of a daily maintenance, more of an avoidance, we're trying to avoid developing osteoarthritis, then that horse is going to go with the LQHA Plus. LQHA Plus, it's a little bit of MSM and glucosamine, but it's primarily hyaluronic acid. So kind of in this theme of joints, the DHA Perform in particular for horses with breathing issues. Will that help joints, or should there be another joint supplement given? So DHA is an omega-3 fatty acid. There are 3 different omega-3 fatty acids: ALA, DHA, and EPA. And you've heard me say before that the DHA and the EPA are the only 2 that actually have a benefit in the horse. That ALA that you get from flax and chia and hemp and other plant sources has to get converted to DHA to have any benefit in the horse, and that conversion is actually pretty poor. So, you know, the DHA Perform, how it benefits the breathing issues as well. There's 2 different breathing issues we have. We either have bleeders, where blood comes out the horse's nostril because the blood vessels in the respiratory tract have actually burst, or we get seasonal allergies, or allergies due to inhaled particulates, which is an inflammatory response, and they're trying to get rid of those particulates. In that particular case, the DHA works as an anti-inflammatory, decreases inflammation, and then helps those breathing issues. In the case of the bleeders, what happens is when those horses are doing intense exercise, and we've got that blood pumping through those blood vessels, there's a lot of pressure on that blood vessel, and that pressure can burst those blood vessels. So if we can strengthen those blood vessels, and the DHA has been done, research has been done to show that it actually strengthens the flexibility of the walls of those blood vessels, so that when under pressure, we've got a lot of blood pumping through them, there's give and take, there's flexibility, so they don't burst and we don't have blood coming out of the horse's nose. So it either works to decrease the inflammatory response or to strengthen the blood vessels, depending on the breathing issue that we're talking about. Will that help other joints, or is there another joint supplement that should be given? Well, absolutely, it will help the joints as far as inflammation is concerned, but it won't do the same job as hyaluronic acid or chondroitin or glucosamine. So it really depends on the level of damage to the joint and the level of support that your horse needs as to whether another joint supplement should be given. If we're again just looking to decrease some inflammation, then the DHA may be fine, but for full-blown arthritis or osteoarthritis, then you should be feeding another joint supplement, either the LQHA Plus or the Optimum Flex. Should the DHA be given year-round or as needed? Again, this depends on the reason why you're feeding it. Are you feeding it to a stallion because you want to improve semen quality? Then you're only going to feed it during the breeding season. Are you feeding it to a horse that gets summer allergies, and those allergies are, you know, they get hives due to the insects in the summertime? then we would just feed it in the summertime? Or are we feeding it due to a respiratory allergy in the spring and in the winter? So it just depends on the reason why you're feeding it. But typically, if we're feeding it due to an allergy, we only feed it during the times that that allergy is evident. Next question, Colt grower, when and why? Colt grower is a vitamin and mineral supplement designed for the young growing horse. We recommend that you start feeding it around 3 months of age, and that's because that's when the lactation curve really wanes in mares, but it's also when the foal's liver stores of vitamins and minerals also is depleted. So in the last phase of pregnancy, while that foal is growing in utero, the mare, through what she's eating, is fortifying the fetal liver. So she's pushing vitamins and minerals into that fetal liver so that when that foal is born, milk is not a high source of vitamins and minerals. They're going to draw on those vitamin and mineral stores in their own liver, but they're going to get it depleted by about month 3. So that's when we recommend you start the Colt grower. Unless you have a horse that has had kind of a rough start to life, or you're worried about growth disorders, or perhaps you didn't know the mare's feeding history and you suspect that she wasn't fed greatly during her pregnancy, you might start that foal around 30 days of age. When would you stop the Colt grower? Typically, we're going to stop around 2 years of age, but that's in our average maturing horses. In our slower maturing horses like warm bloods or draft breeds, you might take them through 3 years of age on the Colt grower. Or again, if you're wondering about the mare's nutrition, whether it was questionable, you may keep your foal on that Colt grower until 3 years of age. Why feed Colt grower? It's fortified with copper and zinc, with calcium and phosphorus in the correct ratios, because we know that they are the most critical for bone and cartilage development. Another question that I've received is orange. Should I give orange to a horse with ulcers? Will it help? I can't really come up with a reason why the DAC orange would particularly directly help the horse with ulcers per se. Um, a horse that is healthy and on a balanced diet will have a better immune function, have better mucous membranes. So that might be an indirect way that orange will help with ulcers. But, if your horse has gastric stress, whether in the stomach or the hindgut, feeding it DAC orange is not going to be the first port of call for fixing that issue. This is a great question. Should horses have red or white salt blocks, or should they eat loose salt? Well, in a perfect world, all horses should eat loose salt because they don't have a rough tongue, so licking a salt block can be difficult for them, and loose salt is easier for them to consume. But if you don't have a fancy salt feeder that's covered, which are kind of expensive, then when it rains, that loose salt just turns into salty water. So a lot of times we feed salt blocks, whether it be in the stall or out in the field. But I always advocate plain white salt, which is just sodium and chloride. That is plain white salt. Anytime it's got any color in it, it's just dirty salt. Red is iron. Iron is red. And so your red or mineral salt blocks have a small amount of mineral, but really the intake is driven by the sodium and chloride. So feed plain white salt, because day to day their horse's requirement and desire for eating salt is going to be different depending on whether they drank a lot, whether they exercised a lot, did they sweat a lot. So sodium and chloride requirements day to day change. What doesn't change is copper and zinc and selenium. The requirements for those minerals don't change whether your horse sweated or not. So plain white salt is always recommended. When feeding a feed with glucosamine in it, there are some senior feeds that have glucosamine in them. Do you also need to feed a joint supplement? Well, again, this gets back to the level of distress in your horse's joint. If you're feeding a feed that has glucosamine in it, only has glucosamine in it. It doesn't have hyaluronic acid and MSM and chondroitin. So if you want a more complete joint protection, you're going to have to add an additional joint supplement that has those ingredients. If we're just feeding it because we like the idea of having some preventative, and there's no actual damage to your horse's joints, then no, you wouldn't need to add an additional joint supplement. Body condition scoring and how to determine the horse's ideal body weight. And this is a great question. It's really difficult to determine ideal body weight, and that's why we use body condition scoring, because body weight really tells you nothing about the horse's body fat or health status. To determine body weight, there's lots of different things that we can do. Obviously, the gold standard is put the horse on a scale and measure their weight. But let me see here. Oops. If we want to determine if we want to estimate their body weight, we can use different equations. So we can either use a scale, a weight tape, but weight tapes only take into account the horse's girth circumference, and then they estimate the length of the horse. So it's not always that accurate. Or we can use this equation where we take a tape measure and we go around the girth and times that by the same number around the girth again, and we times that by the length of the horse. So we actually measure the length of the horse, so it's not a guesstimate. And we divide that number by 330 and we get an idea, an estimate. It's still just an estimate of the horse's body weight in pounds. And the reason why both the scale, both the weight tape and this equation are estimates is they really only account for the barrel of the horse. And they estimate that 330 is an estimate of the horse's legs, head, and neck weight, where the scale actually measures those. But the body condition score, we measure a 1 to 9 scale, 1 being super skinny and 9 being morbidly obese. And when we do this body condition scoring, we really look at all of these different areas, over the neck, the withers, over the ribs, where you do the girth up, the flank, over the tail head, and we average all these out to get a body condition score. Now, this is a horse that's a body condition score of 1. It's emaciated, it's super skinny, it's probably really depressed, appetite is down. You can see all the bones without having to feel at all. Most likely mucus coming out of the eyes and nose because it was unhealthy. At 2, we start to increase the kind of behavior of the horse. We still see all of the ribs. This horse is still way too thin, but there's a little better coverage. A 3, again, we can still see the ribs, but we're starting to hide those hindquarter bones a little bit more. A 4, faint outline of the ribs, but we've pretty much got even coverage over the rest of the horse. But a 4 or less to me is considered thin for most of our horses. A 5 and a 6 is considered ideal. I don't see any ribs on this horse. This horse is in ideal body condition. And unfortunately, there are a lot of people that would look at this horse and say this horse is thin. And that's where the problem lies. We have this overestimated view of what is healthy for horses, and that is where we kind of get into fat horses looking healthy, and fat horses are just as dangerous as thin horses. So this is an ideal body condition. I don't see any bones, but I don't have to press really hard to feel any of them. There's an even skin and muscle coverage over this whole horse. This is a body condition score of 6, but in a different build of a horse, so it's going to look slightly different, but still very ideal. You get a 7, 8, and 9, these horses are all considered overweight, and you can see that over the crest and the withers and where you do the girth up and over the tail head, we've got significant fat pads. So if we go back, it's kind of hard to tell what ideal body weight is. I think if you go online, there is an app that you can download. I think the University of Minnesota maybe developed an app that you can put in some certain measurements, and they'll tell you what the horse's ideal body weight is, but really just use body condition score as a measurement of ideal health status. I've also been asked a lot about vitamin E deficiency symptoms, benefit of feeding natural vitamin E. Well, we have the E Natural. It's a highly concentrated product, about 2,000 IUs per 5 gram scoop, and it's 100% natural vitamin E, and there's really nothing else in it. Because the majority of our horses don't live like this. They don't live in heavy grass pastures for the majority of the year. Horses that live at pasture and are grazing continually will probably consume about 2,000 IUs of natural vitamin E per day. We know that synthetic forms of vitamin E only mimic natural vitamin E by about 12%, so that's pretty poor. Vitamin E levels in hay that's cut from that fresh green grass, within that first week of being cut, 70% of that vitamin E is gone, because when you cut that forage, then you've killed it and it starts to die, and the UV light and the oxidation of that grass really denatures that vitamin E. Well, why is vitamin E important? It's important for the reproductive system. It's a powerful antioxidant. There's stress in the reproductive system. We know that in the male and female reproductive system, that vitamin E can be important. It's important in the muscular system. So when we have muscles, when we do exercise, we break down muscle tissue, right? And we get this membrane disruption. And then through the correct nutrition of protein and vitamins, particularly vitamin E, we repair that muscle tissue and we get bigger, stronger muscles. Unfortunately, when the body is deficient in vitamin E and other nutrients, then we do that exercise and we have that membrane breakdown, but you don't build the muscle back. You just have this broken muscle. And so what do you notice in your horse? A weak hind end, uneven muscling, poor top line is a classic sign of deficiencies in vitamin E. It's also really important for the nervous system, for the circulatory system. We call it a vasodilator because it actually helps to widen blood vessels. So that's why we feed it a lot to horses with metabolic issues, because it helps to widen those blood vessels that are otherwise constricted from chronic inflammation to get blood to places like the hoof tissue. Oops. Also really important for the immune system. We know that older horses that have a decrease in their immune system because of an increase in this oxidative stress. So older horses definitely can benefit from additional vitamin E. What are some of the classic symptoms? Well, the muscle wasting, the uneven top line, also twitching, these weird twitching, and I'll show you a video of that. Low head carriage, dragging a toe. Typically, it's the hind end toe because they've got really weak muscles in the hind end, and it's hard for them to keep, tracking through. Weakness, shifting weight, but we can typically correct these horses in about 3 months. So I want to show you a video of this horse. See, and you'll see the muscle fasciculations or twitching. You can see there in his stifle and in his shoulder, he's twitching like he's trying to get a fly off him, or those quarter horses that have HYPP, he's twitching, right? That is a symptom of vitamin E deficiency, as well as the rest of his body condition. So now look at that horse again after 2 months of vitamin E supplementation. And we don't see that muscle twitching. And we even see we're starting to develop more muscle over his body. He's still underweight, but we certainly don't have that symptom there anymore. We look at this young horse and look at young horses really, it will affect their movement patterns and they will stand on their front feet. So we'll go ahead and watch this video. See, and you can see when she starts to circle this gelding that he's going to start tripping on his front feet. See, he's going to start standing on his front feet. That's weakness and ataxia. His hind end is really swaying a lot also because he's quite weak behind, standing on his front feet. See, that's not normal for horses. Now you're going to see him hold his front leg in the air. It's quite weird, but a classic sign of, you see his front leg is just kind of hovering in the air. When you take them up a hill, they'll stab their toes. And when you go down the hill, you can see a lot of weakness in the hind end. It's just kind of swaying and dropping under himself. When he steps off a curb, he doesn't have great perception, kind of just drops down instead of stepping down properly and dragging, and see, skips a little. So these young horses, now again, that mature horse, you can see the horse on the top left. And granted, I mean, I really like for people to take before and after pictures in the same lighting, because this looks like a completely different horse. The change in coat color has nothing to do with vitamin E. It's the fact that it's taken one in a barn and one outside. But you can definitely see a change in the muscling of this horse and the change in the top line of this horse. So it comes in a 1 and a 5 pound bag, highly concentrated. I usually don't feed any more than 5 scoops a day. That would be 10,000 IUs. That's the max. For most of our disorders, we're going to sit between that 3 and 4 scoops a day. I usually use a 3-month protocol where we do high doses for the first month and then taper it down as we can. This particular product has no added selenium because we want to feed really high doses of vitamin E. I get asked a lot about muscle diseases, in particular PSSM, or polysaccharide storage myopathy, and this particular disorder has a genetic component to it, but these horses cannot utilize sugars and starches for energy. That's why we recommend these horses eat high quantities of fat, so the DEC oil, for example. And we want to really decrease the sugars and starches, so no cereal grains, no molasses, that kind of thing. We also know that these muscle disorders affect the muscle. They affect the nerve tissue. So the vitamin E, or the vitamin E and selenium, can be very beneficial at the indirect effects, the side effects of these muscle disorders. We don't necessarily have anything that's going to fix this disorder. We don't have any drug that's going to fix it, but we can fix the side effects of this disorder with vitamin E, oil, vitamin E and selenium if we're not getting enough selenium in our diet. You know, I get a lot of questions about bleeders. I mentioned this earlier about what happens in that horse that bleeds. The blood vessels come under stress, come under pressure from all of that blood pumping through those capillaries, and the walls of those vessels just collapse. They break. Blood comes out, and you see it coming out of the horse's nose. So if we can add supplements or ingredients to the diet that are going to increase the flexibility and the strength of those capillaries, then that's going to decrease the blood coming out the horse's nose. And we know that DHA, docosahexaenoic acid, is a very beneficial, safe way at increasing the flexibility of those blood vessels and decreasing bleeders. I get questions also about the Breeders' Excel and the Breeders' Choice Plus. Now, the Breeders' Excel is also high in the omega-3 fatty acid DHA. But you'll notice that the DHA Perform and the Breeders' Excel have very different feeding rates. The DHA Perform is simply just DHA, and so and it's very concentrated. The feeding rates are anywhere from 4 to 6 to 8 ounces a day, versus the Breeders' Excel is 16 ounces or a pound a day is what is recommended, and it's DHA and vitamin E. It does not contain any minerals. It's literally the fatty acid DHA and vitamin E. And we know that that combination has positive effects on semen quality and ovarian function. So our older stallions with low count or low morphology, those you're collecting from, can really benefit from the Breeders' Excel. The Breeders' Choice Plus, on the other hand, is a vitamin and mineral supplement for mares and stallions. It has extra vitamin A and selenium to increase fertility. These two products can be fed together to complement each other, but if you're not feeding grain with vitamins and minerals in it, you need to feed the Breeders' Choice Plus. Products per discipline. Now, this is a very difficult question to answer, and I really can't answer it because within each discipline, we have easy keepers and hard keepers, and horses that are high strung and horses that are dopey and need to go slower. You know, I was chatting with a person today about a barrel horse who is, you know, really hasn't got a lot of energy. It's really slow. And so we want to make sure that we're feeding a lot of extra calorie sources, but the correct types of calorie sources. We need those sugars and starches to get that horse to go fast. Oh, but he has a sensitive stomach because he has ulcers. And so we want to decrease the sugars and starches. Well, we can decrease the sugars and starches, but he's going to be slow. Horses that need to go fast, whether it be eventing or racing or barrel racing, they need to consume sugars and starches as their energy source. That's what feeds that quick release, fast twitch muscle fiber that makes them go fast. Okay, so when we're doing that, if they also have secondary disorders like gastric ulcers or hindgut ulcers, and we want to decrease the nutrients in the diet that can exacerbate those, we need to look at other ways to keep those horses healthy, adding cool gut, adding digestive aids, that kind of thing, because we know those horses definitely need that quick release energy. Well, you might say, well, dressage horses, they all need to be calm and sedate, so maybe they all should be on Calm B. Well, I get a lot of dressage owners when they get to the upper levels say, how can I give my horse more energy? I need him to have more spark. So really, products per discipline is difficult. It really is case by case. Calm B, is it possible to have a reverse effect? If so, why? Well, I've never had a reverse effect, but what I have found is if your horse is actively going through a stressful event and you try to give it Calm B, you're trying to load it up into the trailer and it doesn't want to go and it's getting more and more stressed and you think, well, I'm just going to give it some Calm B, it'll calm it down. It's not going to work. You have to feed the Calm B prior to that stressful event. And the reason is when they start to stress, they produce a hormone called cortisol. And the only way to clear cortisol out of the system is by using drugs. So we want to make sure that whatever supplement that we're feeding, in this case the Calm B, to try and calm that behavior, that we're feeding it prior to having that influx in cortisol hormone. But I've certainly never seen it have a reverse effect. Orange superior or direct action. Is it safe to feed free choice as long as it is monitored? It's kind of difficult to monitor free choice unless you've got a game cam out there and you're measuring exactly how much they're eating. I would never free choice orange superior. There was directions for mixing the direct action with salt that you could free choice that, but really then it's the intake of direct action is driven by their desire or requirement for salt. That's why we came out with the lick tub, so that we didn't have to kind of guess at the intake of direct action when fed free choice. So if you want to feed something free choice because you're not doing a lot with your horse or you're not feeding them every day, choose the lick tub versus trying to free choice orange superior or direct action. Allergies and bleeders, we've gone over this several times. The DHA Perform, the vitamin E, going to decrease that inflammation, improve the immune system. Allergies, again, it's what is causing the allergy, and bleeders, we're improving the flexibility of the blood vessel. Cushing's and metabolic disorders like insulin resistance or obesity or laminitis or metabolic syndrome even. We do not have a supplement that directly mitigates these issues. It is an area that we are constantly evaluating. We're constantly looking at nutrients and ingredients that might be of value. It is something we're actively looking at now, but we don't have anything as of yet. What else can you do though? But it's management with these horses. We have to decrease the sugars and starches. If the horse is thin, we need to feed oil to get the body weight on them. We need to feed alfalfa because it's good quality carbohydrates and protein. If the horse is fat, we want to decrease the calorie content. We certainly want to decrease the sugars and starches. This was a good question. A dealer typed into the Facebook page, the authorized dealer page, that a herbalist has recommended to her client to feed high levels of selenium to chelate heavy metals in the client's horse's system. So let's start with, what does chelate mean? Chel means claw, to grab onto. And so chelation is just to grab onto something. When I typically use chelation, we're talking about chelated minerals, where we take an organic substance like a protein and we grab that onto something like zinc or copper so that it will be more bioavailable and more readily absorbed across the intestinal wall. In medical terms, when we have heavy metal toxicosis, we also talk about chelation, and we use ingredients in usually an IV, that these ingredients are going to latch onto those heavy metals, chelate to those heavy metals, and suck them out of the digestive system and out of the body, instead of with the chelated minerals taking them into the system. Now we know that selenium is extremely dangerous if it is in excess in the horse's diet. So I would 100% never recommend high levels of selenium to chelate heavy metals in the horse's system. Number one, if the horse is testing positive for heavy metals, which this is something that you can actually test in horses' hair. I'm not usually a proponent of hair tests for anything else, but we can test heavy metals in hair tests. But we also want to work out, where is it coming from? Test the soil, test the forage, test the water to see where those heavy metals are coming from. And then you can use other chelating substances, such as vitamin E, which is much, much more safe than using selenium. I get questions a lot about the DAC oil and about calories and megacalories, and I give people the energy content in megacals, and they ask me what the calories are. So I've just kind of typed this out. Oil, the digestible energy in oil is 4.2 megacals per pound. That mcal per lb stands for megacalories per pound. People measure our food. We measure our food in calories, but you can see I've got a capital C there because it's actually kilocalories. It's not just regular old calories. Horses eat significantly more calories per day than horses, so we use megacals instead of calories. It's like using kilograms instead of grams, or pounds instead of ounces. It's just a higher unit of measure. 4.2 megacals is the same as 4,200 calories. So let's look at a thin horse. I get asked constantly about putting weight on horses. And if we take that 1,000-pound horse and we want to gain 40 pounds on that, I can safely do that in about 60 days. And if we look at the different ingredients that we can use and we look at that digestible energy value, you can see oil has 4 times the energy density of any of those other ingredients like oats or rice bran or beet pulp or alfalfa hay. So oil is always my go-to. Just a little over 2 measuring cups a day of oil will give you that weight gain. Now, there's been other questions about the vitamin E. What would be a recommendation for a horse that has that chronic head shaking? Would the E natural help? You know, that is a particular syndrome, and there is research on head shaking, that it's maybe more of a musculoskeletal pain. I'm not sure whether vitamin E would be beneficial. It certainly wouldn't hurt, but you might also look at things like yucca as an anti-inflammatory if there's actual pain in the TMJ joint. When we look at oil, you can see 1 ounce of oil, for example, has 0.29 megacals of energy versus 1 ounce of bloom has 0.14. So oil has double the energy content of bloom. So if you're looking for weight gain, remember oil is more dense in calories than bloom. If we're looking to replace something in the diet and we say, well, I can take about a pound of alfalfa. How much oil do I need to feed if I take out a pound of alfalfa? If we're just looking at the calorie content and nothing else, you take out a pound of alfalfa, you can replace that with 3.5 ounces of oil. If you take out a pound of beet pulp, you would need to replace that with 4.5 ounces of oil. A pound of oats or rice bran, you would replace that with 5.5 ounces of oil, or a pound of bloom, you would replace that with 7.5 ounces of oil. Other disorders, I've been asked to address specific disorders and treatments. So developmental orthopedic disease is a problem that we see in young horses and covers fasciitis, osteochondrosis, flexural deformities, limb deformities. We know that there's a huge nutritional component. We know in those young horses, the Colt grower and the Cmc Paste are ideal. The Colt grower, as we've discussed, we start at 30 days of age if we're worried about developmental orthopedic disease. But the other reason why the Colt grower is so spectacular for these young horses is we have that calcite, that really bioavailable calcium source. And this graph is showing some research done on horses that were supplemented with that calcite, that highly bioavailable calcium sources, versus horses that got the placebo. And you can see at 30 days and 90 days of treatment, the blue bars represent horses that did not get the treatment, and the red bars horses that got the calcite. And you can see it's 3, 4, 5 times the bone density when horses were fed calcite. So that's why it's in the Colt grower. The Cmc Paste is highly concentrated copper, manganese, and zinc, and it's a therapeutic product that you're going to feed for 1 to 2 weeks at max, half a tube to a tube a day. Tying up is another one of those umbrella terms. It's going to cover azoturia, exertional rhabdomyolysis, ARIA, PSSM, which we discussed, EPSM, all that are slightly different in their biochemical pathways, but they all manifest the same, muscle damage and pain, and we feed them all the same. We take away the sugars and starches, so we have to replace that with oil. Their glucose metabolism is not functioning correctly. So calories from oil to give them energy versus using sugars and starches. Muscle damage, a lot of times you're either using the natural vitamin E or the E and selenium. Sometimes these horses can be a little excitable, so we're going to use the Calm B to decrease that excitable behavior, which can exacerbate the muscle pain. And a lot of times they sweat a lot, so we're going to have to replace those electrolytes with lost salts. Colic. Now there's a lot of different colics that horses get, but compaction colic and gas colic are probably the two most common. Impaction colic is literally just a dehydration of the gastrointestinal tract. We're going to feed things like digestive feed additive so that it can keep that fiber being digested and keep that food moving through the digestive system. And the electrolyte is going to increase water intake so we can rehydrate that digestive system. Gas colic, well, those bacteria that live in the hindgut, it's really easy for those to get out of balance. And when they get out of balance, they produce more gas, and that can build up and cause pain. The digestive feed additive is going to stabilize those bacteria so that they don't create a lot of excess gas. And again, the sugars and starches that we feed in the diet can also exacerbate those discrepancies in bacteria. So feeding more calories from oil can be beneficial. We've talked about ulcers. 90% of horses have ulcers, 60% colonic ulcers, and over half the population have them in both regions. And we know that it's fasting and meal feeding and high grain diets and the stress we put on our horses and the long-term use of drugs like bute that cause gastric ulcers. Now, remember I talked about the pre-buff and how when you give your horses free choice access to grass or hay, that the acidity sits between a 4 and a 7. So these horses had the pH measured for 24 hours while they were eating free choice grass hay, and the pH sat between a 4 and a 7. That's a perfect range for that pH. But when you take away the feed and the grain, and you only let them drink water, you can see by just 1 hour, the acidity in the stomach was down between a 1 and a 2, which is really strong. By 18 hours, bleeding lesions. By 6 hours, we had reddening of the stomach lining, which is the precursor to gastric ulcers. And what's not uncommon is, especially in the wintertime when the day lengths are shorter, we're probably feeding our horses by 5. And they're done by 7, and we're not coming back till 7 a.m. the next morning. That's a 12-hour window when they've got nothing to eat. I really don't want horses to have nothing to eat for more than 2 hours. So that's where using your slow feeders, etc., becomes very positive. What are you going to use in your management strategies for ulcers? Well, alfalfa, because it's high in calcium, frequent meals so that they're constantly producing saliva and chewing and buffering that stomach acid. The DDA will help to stimulate appetite because it's got B vitamins in there. The DAC oil, if we can feed that to take away some of the calories coming from grain, that's ideal. And of course, the DAC Cool Gut. Hindgut ulcers are definitely more painful. Look at that tissue. We also know that the hindgut is much larger than the stomach of the horse. So if you put ulcers or this reddened tissue through the whole hindgut, you can appreciate how painful that is. A little more difficult to determine, but typically these horses with chronic diarrhea have some hindgut issues. Same things causing it, the meal feeding and high grain diets, but now add in parasites and salmonella to the list of things that can cause hindgut ulcers. Again, pelleted or cubed forage because that long stem hay can be a little abrasive. Using something like Cool Gut that's got the live cell yeast in it, which is going to stabilize the hindgut acid. The Butapearl Z, which is zinc encapsulated with butyric acid, which is going to heal that hindgut tissue. And also using oil instead of carbohydrates for weight gain or energy. This was a horse that we trialed the original formula of Cool Gut on, grade 3 ulcers, trailed it from Kentucky to Oklahoma, and then back again, all whilst it was getting 3 ounces a day of Cool Gut. And the veterinarian said this is a game changer because we can't even kind of see where that original ulceration occurred after only 3 weeks. So the Cool Gut, it has that butyric acid and zinc in it, but it also has this calci powder to increase the buffering in the stomach acid. The pasture lick, I got questions about the digestible energy content on the pasture lick. I had a question saying that, some performance horse trainers were feeding the pasture lick in addition to the horse's regular diet because to help them gain weight. We looked at the energy content of oil. Now, most of your high-fat, high-fiber feeds are going to run between 1.3 and 1.5 megacals per pound. The lick tub is 0.25 megacals per pound. There's really no energy in it. So this is not a way to put weight on your horse, that's for sure. If I can only buy one product, what should it be? I'm always going to answer the DAC Digestive Feed Additive or the DDA. It's inexpensive. It's the most bang for your buck. It's got yeast, it's got a mold binder, it's got biomass, which is going to bind bag bacteria. It's got a little bit of minerals to help support the horse. We know that stress and lack of exercise and feed changes and staff changes all affect this horse. No other product has the integral in it, which is going to bind up mycotoxins. The DDA is something that every horse should get every single day. So I end where I begin. Start each day with DDA. Every horse every day should eat it. It's the one thing that every horse should get and cannot go without. So I appreciate you all getting on the webinar tonight. And if you have any questions, feel free to ask them now.